blood and bone marrow stem cell transplantation and cellular therapies has definitely become a very advanced therapy for many blood diseases, both malignant and non-malignant, such as blastic anemia or sickle cell anemia or thalassemia. The issue is that because we have become so capable of transplanting patients even sicker or older, that other levels of difficulties have come up. Access to transplant has, I think, a new dimension, is a multi-level dimension that includes the patient condition, for sure, patient disease, but also social issues, how the patient can be taken care of, what social support does he or she have, financial abilities, location, transportation, comorbidities that are often in the picture. Quality of life is a multifactorial condition, and how do we address this issue is a topic of a study that we did to understand and to make sure that we have a combination of financial, social, and medical answers. We have to think that 70% of the world is basically a low or middle income area where patients often have no access to therapies, to chemotherapy if they have cancer, or to a high level of care. So when we develop a high technological procedure like a stem cell transplant or cellular therapy, how do we address the need of these people? And in fact, actually, this has become available in many countries, but the problems actually are even bigger. Patients cannot afford. Doctors are not well trained. Hospitals have not achieved the level of infrastructure that is needed. So what we want to make sure that we develop is a concept that access to care is about significance of treatment, not just efficacy. The treatment has to be affordable, has to be available to the majority of the people. Access requires people to be trained. Low cost, high performance is a combination that we have to invest on, that we want to invest on. Training people in our countries and to make sure that when they go back to their countries, they can offer the treatment. Even in the areas in our countries here, in the rich countries, there are areas where people have no access to chemotherapy or to transplant. Patients on Medicaid, Medicare often have to pay for co-payments or cost of drugs that they cannot afford. Social support is not offered. So we want to make sure that transplant and cellular therapy can be available, but we want to address at different levels of the society, of our community, what is actually necessary. Thank you.